Hi, everyone. Welcome back to another episode of Ask a Care Manager. My name is Ryan Abramski. I'm the Director of Business Development, and I'm joined as always with Teresa Jackson, our Director of Care Management. The both of us work for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for over 22 years. As always, the Ask a Care Manager video series is brought to you by our friends over at the Senior Living Resource Magazine and their website, seniorlivingguide.com, your one-stop local and statewide resource for all things senior housing and health. Anything from assisted living to memory care, to home care services and care management like EasyLiving, to senior wellness and finances. Check out the Senior Living Resource Magazine and their website, seniorlivingguide.com. And if you get the latest episode, check out EasyLiving on page 80. And as always, they will mail it directly to your home. So Teresa, welcome back to another episode.
Thank you.
So welcome and so glad to have you. And as always, we have several themes for every single month. We started off this month talking about alcohol awareness and alcohol awareness, especially in our senior and elderly population, and identifying and helping families kind of navigate that tricky subject sometimes. But to continue on, we're going to move on to a new topic, which is Parkinson's disease. The month of April is also Parkinson's Disease Awareness Month. Parkinson's disease is probably a pretty famous disease. A lot of famous individuals do have Parkinson's disease, unfortunately. Probably some of the most famous are Muhammad Ali, the famous boxer, Michael J. Fox, famous actor. He's probably one of the most prevalent individuals for the Parkinson's disease awareness. Musician Ozzy Osbourne also has Parkinson's disease. So a lot of different people, and it can, that's just, I think, proof that it really can affect anyone. So wanted to talk today a little bit about the disease, some different things that people maybe should be aware of, how it progresses, and then, obviously how our home care services and our care management services can also help those individuals unfortunately suffering from that disease.
Yes, and one of the things I'd like to point out is, when Michael J. Fox first started having symptoms, he was very young.
Mm-hmm.
I think it was during his movie Doc Hollywood, if you remember that movie. But Parkinson's disease basically is a neurodegenerative disorder that affects predominantly the dopamine-producing neurons in the brain. So symptoms can generally develop slowly over the years, and the progression of the symptoms can differ from one person to the next. So no two people are going to experience the same symptoms or rate of progression because it depends upon each individual and how the illness affects them. I think what most people think of when they think of Parkinson's disease is the tremor, and the tremor's mainly at rest and describes as like a pill rolling tremor in the hands. But then there's also one of the other symptoms is bradykinesia, and that's the slowness of movement, just sort of the stiff slowness of movement, the limb rigidity a person may have, and this may also present as like a gait and balance issue.
I think we've seen both of those, with Muhammad Ali, he definitely had more of the tremors. And I think with Michael J. Fox, we see more of that, rigidness and lack of use of his extremities currently.
Yes, and I mean the cause of Parkinson's disease remains mostly unknown. I mean, although there's no cure, there are treatment options that includes medications and surgeries, but it's not a fatal disease. But the disease complications can be very serious. I mean, I personally know of someone very young that's around my age, and then someone that's a senior, that's an older adult that has Parkinson's disease, and the way they approach their treatment is different, and it can be challenging, and you can see it is a progressive illness, so you can see, even though it may progress differently within individuals, you can see that with my friend that is an elderly senior, she's at that point where she does need a lot of assistance. And that's where care management and home care can come in to help at times like that. But I remember someone asking me, well, what are some of the, besides the trembling of the hands, what are some of the other symptoms you can look for? And I know I had a client several years ago. She had Parkinson's disease, and one of her symptoms was she was very soft spoken. She had a very low voice. She actually went to a speech therapist that specialized in therapy specifically for people with Parkinson's disease. Mm-hmm. And I made sure that she always had her personal emergency response pendant, or her I've fallen and I can't get up pendant on, because her husband, whom she lived with, was extremely hard of hearing. So I remember one time she had her pendant on. She was in the shower. She fell in the shower. And there would have been no way. They lived in a 2-story home. There would have been no way, if she was calling out to him, that he would have been able to hear her. Mm-hmm. I mean, even with his hearing aids on, he didn't hear very well. But she was able to press her pendant, and he knew that it wasn't, you don't need to send 911, but could you tell my husband to come upstairs? I'm in the bathtub and I can't get out.
Yeah.
But that's just like one of them. Again, I've already mentioned, like, trouble walking. Oddly enough, constipation is a symptom. This one I did not know, but when we were doing our research, I found it. Small handwriting. If your handwriting is getting smaller than it used to be in the past, or even a loss of smell, trouble sleeping. So you see that there's a lot of different things that could be related to other issues. So it is very important that you see a neurologist that specializes in brain disorders to get a proper diagnosis.
Absolutely.
And there's not like there's one specific test that you can go into and say, yes, you have Parkinson's disease, or no, you don't have Parkinson's disease. But there's specific tests and that a neurologist can walk you through and help determine if it is Parkinson's. I know one of the things that we see a lot with our clients, because we're working with them in the later stages of the disease process, and there is a dementia that is specifically related to Parkinson's. So that is something that you need to plan for, making sure you have your advocate, your power of attorney, healthcare surrogate all in place if this is something, an illness that you have. Because one of the, symptoms can be the dementia, Parkinson's dementia. So, again, with any illness, a care manager is going to encourage proper diagnosis, but also putting together that support team, to make sure when you do need help, be it a care manager, a home care partner, to provide assistance, dressing, bathing, or something like that is there for you, so you can remain safe in your home as long as possible.
Absolutely. And I think, with the tremors, I know with our Parkinson's disease patients, feeding themselves is very, very difficult with those tremors. And that is a really important service that we do provide with our clients as well on the home care side. It's not just meal preparations, but it could actually physically be helping stabilize their hand, or feeding them themselves, because if they're shaking and their tremors are too much, it's going to be hard for them to either get the food in their mouth or keep it on their fork or their spoon as well.
Exactly. Making sure that an occupational therapist can come out and do an evaluation, and I've seen this a lot throughout my career, where someone with Parkinson's will have a weighted spoon, and you've probably seen them. They've got the larger handle, so they're easier to grasp, and they're heavier, or even on their toothbrush, to make it adaptive to where they can still remain as independent as possible. And that's what we're trying to do, and make sure their quality of life continues to be as good as possible. And so just little things like having that weighted spoon so they can feed themselves and remain independent is just key with what can be done to help someone.
Absolutely. Absolutely. Well, Teresa, I really appreciate the information on Parkinson's disease. I know out there our audience does as well. It's always important to talk about these different diseases each and every month and identify them and have the awareness out there because, as we discussed earlier in the video, it really, really can affect anyone out there, famous or not. It's still something that affects people. So we'll put some more information on our blog and on our website, and also link some more information down to the Parkinson's disease website, so you can find out more information about the disease as well. And as always, please leave some comments in the comment section. Send us a direct message online and through Facebook, or you can always go to our website and fill out the contact us form, and we will reach out to you directly at the numbers that you provide. So as always, Teresa, thank you so much for your always great information. And we thank all of you for joining. We'll see everyone next time.